Hello, I'm Dr. Emily Carter, and today I'm going to share with you information that could literally save your life or the life of someone you love. You know that feeling that something isn't right with your body, but you ignore it because you think it's just fatigue? What if I told you that your brain might have been calling for help for weeks and you simply haven't been noticing? There's a dangerous myth circulating out there, and it could cost you dearly. Many people believe that a stroke happens suddenly, out of nowhere, like lightning striking from the sky without warning. But the scientific truth is very different, and that's what we need to talk about right now. The reality is that your brain begins sending warning signals long before a stroke actually happens. The big problem is that these signals are so subtle, so easily confused with everyday stress, with the hustle of modern life, with poorly slept nights, or even with age, that most people simply ignore them until it's too late. If you're over 50 years old, if you've been feeling more forgetful lately, or if you've noticed small changes in your body that you can't quite explain, I need you to stop everything you're doing right now and pay very close attention to what I'm about to reveal. I'm not exaggerating when I say that this conversation could completely change the course of your health. First of all, do you know what really happens inside your brain during a stroke? Let me explain it to you in a very clear way. A stroke, or cerebrovascular accident, occurs when blood flow to a part of your brain is suddenly interrupted. This can happen in two ways. Either a clot blocks an artery and stops the blood flow, or a blood vessel ruptures and causes internal bleeding. In both cases, the result is devastating because without oxygen, without that blood rich in nutrients reaching the neurons, your brain cells begin to die within minutes. And every minute that passes without treatment means irreversible loss of memory, movement capacity, speech, autonomy to do the simplest things in your daily life. But here's the secret that most people don't know, and that can make all the difference between preventing a tragedy or living with permanent disability. Before the actual stroke happens, many people go through episodes that medicine calls transient ischemic attacks, known by the acronym TIA. Think of these episodes as rehearsals for the disaster that may be coming. During a TIA, the brain suffers a temporary interruption in blood flow that lasts only a few seconds or a few minutes, and then everything returns to normal. That's exactly why the person thinks it wasn't anything important, that it was just something passing. They think, oh, it already passed, it must have been my imagination, and continue with their life normally. But these episodes are like fire alarms ringing loud and clear, shouting at you, look, something is very wrong here inside. Your arteries are getting clogged, your blood vessels are fragile, and may not hold up much longer. And if you don't listen to these alarms, if you continue ignoring the warnings, the complete and devastating stroke could be waiting for you just around the corner. Have you ever stopped to think how many times your body tried to warn you about something and you simply let it pass? Let me tell you the real story of a patient I'm going to call Martha. She was 62 years old when she began to feel something different, something she couldn't quite explain. Martha was preparing lunch on an ordinary Tuesday when suddenly the spoon she was holding slipped from her right hand. It didn't hurt at all. It wasn't a pain, it wasn't a cramp. It was simply as if her hand had turned off for about 20 seconds, as if the command from her brain wasn't reaching her fingers. She let out a nervous laugh, picked up the spoon from the floor and thought, it must be fatigue. I worked too much this week. 2 weeks passed and Martha was talking calmly with her daughter when she froze in the middle of a sentence. She knew exactly what she wanted to say. The word was on the tip of her tongue, but she simply couldn't make the sound come out of her mouth. She remained silent for about 30 seconds, embarrassed, while her daughter looked at her with concern. After half a minute, the words came back and everything was normal again. Martha joked about the situation and said, "Oh, it's age catching up. Sometimes we forget words." And she left it at that. The third time, Martha was driving to do some shopping at the supermarket when she felt a very intense dizziness, the kind that makes you think you're going to faint. And the vision on her left side became completely blurred. She had the sense to pull the car over to the shoulder, took a deep breath, waited a few minutes, and the dizziness passed. Her vision returned to normal. And you know what she did? Nothing. Martha didn't tell anyone about what had happened. She was afraid of overreacting, afraid of being called dramatic, afraid of bothering her family with unnecessary worries. 3 days after this last episode, Martha had a severe and devastating stroke. She completely lost movement on the right side of her body and much of her ability to speak. She spent months and months in intensive recovery treatment, doing physical therapy, speech therapy, relearning basic movements that she used to do without thinking. When the neurologist finally explained to her that all those previous episodes were very clear warning signs and that the stroke could have been completely prevented if she had sought medical help the first time, Martha cried desperately. She said through tears, "I thought it was all in my head. I thought I was making up problems. And it's exactly because of stories like Martha's that I need you to know right now. The 5 most common and most dangerously ignored signs that may indicate a stroke is approaching. These signs are based on solid scientific evidence and thousands of reports from patients who survived strokes and who, looking back, were able to identify the warnings they didn't pay attention to. The first sign is sudden weakness or tingling on one side of the body. It can happen in your arm, leg, or face. It usually lasts only a few seconds or a few minutes. You feel as if that part of your body simply shut down for an instant, as if the neural command was cut off. Many people confuse it with poor circulation or with that feeling of a pinched nerve when you stay in the same position for too long. But if this symptom appears suddenly, without a clear reason, without you having been in a strange position or done physical exertion, this is a red flag you cannot ignore. Have you ever felt something like this and let it pass? The second sign has to do with your speech and your ability to understand words. Suddenly you can't speak properly or you can't understand what people are saying to you. You know the word you want to use perfectly. It's right there in your head, but it just won't come out of your mouth. Or someone is speaking to you in clear English, and you can't process the meaning of the words. It's as if the person was speaking a completely different language. This happens because the area of the brain responsible for language is being temporarily affected by the lack of adequate blood supply. If this happens to you, even if it only lasts a few seconds, you need to seek medical help immediately. The third sign is sudden loss of vision in one or both eyes. It can appear as a dark spot in your visual field, as blurred vision that comes out of nowhere, or as a very characteristic sensation of a curtain falling over your vision. Many people think it's a common vision problem, that they need to change their glasses, or that it's eye fatigue from spending too much time in front of the computer or phone screen. But if this visual alteration appears suddenly and disappears within a few minutes, it could be your brain warning you that blood flow to the region responsible for vision is compromised. Can you imagine the results if you pay attention to this warning and seek help before it's too late? The fourth sign is intense dizziness or loss of balance without any apparent reason. I'm not talking about that slight dizziness everyone feels when they get up too quickly from bed or from a chair. I'm talking about a very strong sensation that the floor is spinning beneath you, that you're going to fall at any moment, that the whole world is rotating. It often comes accompanied by nausea or even vomiting. If this happens without apparent reason, meaning you're not sick with the flu, you haven't recently changed medications, you didn't make any sudden movement, it could be a very serious sign that your brain's blood supply is compromised and needs urgent attention. And the fifth sign, which is particularly frightening, is a sudden headache completely different from any other headache you've ever felt in your life. It's not that common tension headache or migraine you already know. It's an explosive pain that appears out of absolutely nowhere and is described by many patients as the worst headache of their lives. It can come accompanied by neck stiffness, mental confusion, difficulty thinking clearly, or intense vomiting. This sign is especially linked to hemorrhagic stroke, which is when a blood vessel ruptures inside the brain. And this situation is an absolute medical emergency that cannot wait even a single minute. Now that you know these 5 signs, let me ask you a very important question. What should you do if you recognize any of these signs in yourself or someone close to you? Here's the golden rule that can save lives, and I need you to engrave this in your memory forever. Never, under any circumstances, wait to see if the symptom will pass on its own. Even if the symptom completely disappears within a few minutes, even if you feel fine and normal again, you need to seek medical help immediately. The emergency protocol exists for a very specific reason. The faster you get to the hospital after the first symptoms, the greater your chance of reversing brain damage or preventing the complete stroke from occurring. Medical science has already proven that there is a therapeutic window of up to 4.5 hours after the first symptoms of a stroke appear. Within this time period, thrombolytic medications can be administered to dissolve the clot that's blocking the brain artery and literally save your brain from permanent damage. But if you stay home waiting, thinking it's silly, thinking it will pass, thinking you don't want to bother anyone, that precious window of opportunity closes, and the price you can pay for that wait is far too high. Permanent disabilities, loss of autonomy, dependence on other people for basic activities, or even death. You know what happened to Martha after she recovered? She went through a complete transformation in how she took care of her own health. She began to rigorously control her blood pressure, completely adjusted her diet to a healthier one that protects the cardiovascular system, started walking every day. But most important of all was that she taught the entire family to recognize these warning signs. She didn't want anyone to go through what she went through. And you know what happened 6 months later? It was her father-in-law who had a transient ischemic attack. But thanks to everything Martha had taught the family, as soon as the first symptoms appeared, they took him straight to the hospital. He was treated in time. He had no lasting effects. Today he's alive and well because someone knew how to recognize the signs and acted quickly. The difference between losing everything you've built in life and continuing to live with quality, autonomy, and dignity can be exactly in recognizing a strange tingling, a word that got stuck in your mouth, a dizziness different from normal. Your body talks to you all the time. Your brain sends clear warnings when something isn't right. The question I'm asking you now is, are you listening to what your body is trying to tell you? Or are you so busy, so accustomed to ignoring the signs that you'll only pay attention when it's too late? The scientific data is clear and frightening. Strokes are the second leading cause of death worldwide and the leading cause of permanent disability in adults. Millions of people every year lose the ability to speak, to walk, to take care of themselves because of a stroke. But here's the good news, the news that should be in every newspaper. Medical science has already proven definitively that up to 80% of all strokes can be prevented. 80%. This means that in the vast majority of cases, you have the power to prevent this from happening to you. The first essential step for this prevention is to know exactly these signs that I showed you today. The second step is to act without fear, without shame, without thinking you're overreacting or that you're going to bother the doctors for nothing. If you recognized any of these signs in yourself or someone you love, don't ignore them in any way. See a neurologist as soon as possible. Get all the necessary tests to evaluate the health of your blood vessels and your brain. Take proper care of your blood pressure, because hypertension is one of the biggest risk factors for stroke. Control your cholesterol levels because fat plaques in the arteries can cause fatal blockages. If you have diabetes, keep your glucose under strict control. And most important of all, always remember that your brain deserves exactly the same careful and preventive attention that you give to your heart. Because when it comes to a stroke, every second lost is a neuron that dies. And every neuron you lose is a small but precious piece of who you are, of your memory, of your personality, of your ability to live fully. I want you to leave this conversation today with a clear mission. Protect yourself and protect those you love. Share this knowledge with your family, with your friends, with your aging parents. Stay alert to the signs, stay vigilant, and most importantly, stay alive and healthy to enjoy every precious moment that life has to offer you. If this video was useful to you, if you learned something important today, share it with other people, because you might be saving a life. Leave me a comment below if you've ever experienced any of these signs or if you know someone who has. And subscribe to the channel to receive more quality content about health and prevention. I'm Dr. Emily Carter, and I'm here to help you live better and healthier. See you in the next video.